Poverty is a complex issue. The life of people is improved not only by earning more money, but also improving health, housing, education. Our portfolio tries to allocate resources in each of these areas. My role is to improve that channel between funders and the nonprofits. So I want to see the best organizations receiving the most capital possible. We have evaluated close to 100 organizations over the past 6 years. Only 25 have made it to the portfolio, and those are the organizations with the highest returns and the most stable performance.
We take our dental clinics to 63 schools and early childhood programs across the Twin Cities. We have a whole dental setup. We bring in dental chairs and travel equipment, and we can set up as many as 6 dental chairs in one space.
Create a Smile is effective because they are sticking to their mission of preventing disease and educating kids about the importance of oral health.
It's effective because we're doing basic prevention. And if you can use the preventative services and tools that we have, like sealants and fluoride at a young age, it really sets people up for a lifetime of good oral health.
The American Indian OIC as a whole provides services to about 1,200 people. We have 4 core departments that are critical to our urban indigenous community. One of them is the Dakota Institute of Higher Education, and this is a department of higher education approved private school that's really intent on getting folks placed with meaningful wages and careers. And so we have a slate of trainings that are really market viable with good earning potential.
Constellation's approach to grant making relies heavily on evidence. We measure and expect actual impact from every dollar that we give away. Constellation's metrics try to assess actual improvements in health and income of the people served by these organizations. To be able to capture the benefits that an organization generates, we use what is called a benefit cost ratio. The larger that ratio, the larger the impact.
What they found in the analysis was just the enormous financial impact it had for the family across the lifetime.
We were allowed to really look at the data yielded by the programs in a different way, and it helped with our overall strategic vision of how do we optimize our programs and continue to operate at a high level of performance.
On our end, receiving support that's so generous and so open, the fact that it's general operating and not restricted, is enormous. We know that we're ready to scale, we're ready to grow in a big way. We know our model works and that it's low cost.
We can say with a level of clarity and authority that the investment in our organization is one of the best investments that you can make, because you're not only investing in human beings to do better, but you're doing so in a way that will generate savings for the wider society as a whole.